Hi, this training is about supervision, what it looks like at JADE, what it's for, and how you can get the most out of it. Whether you're a new hire, an intern, or just stepping into your first clinical role, supervision is one of the most valuable relationships that you'll have. And it's not just about meeting licensure requirements, it's about helping you grow into the clinician that you're becoming. So before we jump into theories and models, let's talk about what we're really doing here. At the end of this training, you'll be able to understand and apply key models of clinical supervision used at JADE, including the discrimination model, integrated developmental model, and trauma-informed approaches that will help tailor supervision to the person, not just the paperwork. You'll be able to reflect on your own development as a clinician, what stage you're in, how you learn best, and where your growth edges are. You'll be able to engage in supervision as a supportive, collaborative relationship. And we'll talk about how to show up, what to bring, and how to get feedback that's actually helpful, not performative or judgmental. You're also going to be able to identify tools for addressing countertransference, burnout, and fatigue, because we're in a field where our emotional load can get heavy, and supervision should help carry some of that weight. And finally, you'll learn to differentiate between clinical and administrative supervision and why both are necessary. One keeps you growing, and the other keeps you grounded. So if you've ever wondered, what should I bring to supervision, or how do I know if I'm getting better at this training is for you. So let's get started. So let's start by grounding you in what supervision actually looks like here at JADE. Because if you've had different field experiences or none at all, it's helpful to get clear about what to expect and how to make the most out of it. Bernard and Goodyear define supervision as an evaluative relationship that extends over time with the purpose of enhancing the professional functioning of the supervisee, monitoring the quality of services offered to the client, and serving as a gatekeeping function for the profession. So, in many ways, supervision mirrors therapy itself. Think of it as a parallel process. Your client has you, and you have a supervisor. Your client reflects on their life, you reflect on your clinical work. Your client is learning to trust, and so are you. So, first things first. At JADE, weekly individual supervision is the minimum standard. You'll be assigned a supervisor when you onboard, and you'll meet with them one on one to talk about your clinical work, your growth, and anything that's coming up in sessions that you want support with. You'll also have access to group supervision and weekly staff meetings. And these aren't just for check-ins, they're built-in opportunities for community-based supervision. You'll hear other clinicians talk through challenges, share perspectives, and you'll be reminded that you are not alone in the things that you're struggling with or unsure about. So think of it like this. Just like our clients benefit from individual therapy for depth and self-exploration, and group therapy for perspective and shared experience, you will benefit from both individual and group supervision in the same ways. They both serve different purposes, but both are going to be part of your growth. And I want to be super clear. Supervision at JADE is not about policing your work. It's not a hidden audit. It's not somebody looking over your shoulder waiting to catch mistakes. Supervision exists to support you, to help you think through cases, get unstuck, deepen your clinical lens, and continue developing your own voice as a counselor. Is chart review part of it? Yes, but that's not the point. Chart review is just one way of ensuring that your clinical work is clear, ethical, and aligned with what you're trying to do. But supervision is where we zoom out and ask, how are you doing in this role? Where are you growing? What do you need? What feels hard or unclear? And that said, let's talk about a boundary that matters. Supervision is not therapy. You are absolutely going to talk about emotional things in supervision because this work is emotional. You're going to notice patterns, triggers, reactions that you have to clients, and moments that feel personally charged. That's part of being a human therapist. But when supervision starts to touch deeper personal territory like past trauma, grief, attachment wounds, or things outside of the scope of your clinical work, your supervisor may gently suggest that you process that in counseling. Not because they don't care, but because even though we're all therapists, we can't be your therapist. Maintaining that boundary protects the supervision relationship. It makes sure that you are getting the right kind of care in the right place and that supervision stays focused on your professional development, even though sometimes there might be an overlap between professional and personal development. So here's what supervision at JADE is. It's a relationship, it's a tool, and it's a space for feedback, reflection, and figuring things out together. And here's what it isn't. It isn't surveillance, it isn't therapy, and it's not something that you have to navigate alone. So let's move into the models that we use to help guide the structure of supervision, starting with one of the most accessible, the discrimination model. So just like in counseling, there are dozens of theories and models for supervision. No single approach fits every supervisee, every supervisor, every situation, or every stage of growth. Just like many therapists blend counseling theories, say pulling from CBT and person-centered in the same session, good supervisors often integrate supervision models too. At JADE, we use this integrative approach. We pull from several supervision frameworks so that we can match what you need when you need it and support you in the ways that make sense for how you learn best. So here are 4 models that shape how we do supervision here. There's the discrimination model, the integrated developmental model, the systemic cognitive developmental supervision model, and there's also trauma-informed supervision. So starting with one of the most widely used and accessible models of clinical supervision, Bernard's discrimination model, developed in 1979. It's simple, it's flexible, and it's deeply grounded in real supervision needs. And this model helps supervisors identify what kind of support you need in the moment and choose a role accordingly. You might be new and need clear instructions. You might be emotionally stuck and need a space to explore, or you might be ready to brainstorm options. In any of these scenarios, your supervisor can flex between 3 primary roles. Your supervisor will act as teacher when you're learning something new or need some direct, structured guidance. So that might sound like, hey, let me walk you through how we do ASAM updates. Your supervisor can act as counselor when your emotional response is affecting your clinical work. So they might say something like, hey, it sounds like this client reminds you of your sibling. Do you want to explore how that might be impacting your reactions? And your supervisor can also act as a consultant when you're ready to think critically and collaboratively about next steps. So that might sound something like, there's no one right way to approach this. What have you already tried? So the roles aren't hierarchical. It's not about moving up a ladder from teacher to consultant. Instead, the model allows for fluidity based on the specific needs that you're bringing into supervision, because even seasoned clinicians sometimes need a teacher, and new clinicians often have consultant level insights. So now let's talk about what we're focusing on when we're in these roles. The discrimination model organizes supervision into 4 focus areas. For intervention skills, that means it's focusing on what you're actually doing in the room, techniques, skills, and clinical strategies. Conceptualization is about how you understand what's going on with the client, case formulation, diagnoses, and themes. Personalization is how your own stuff, your identities, your values, your history, your culture shows up in the work. And professionalism is how you show up as a clinician, and that might be boundaries, documentation, ethics, and behavior. So this model supports your growth by making supervision intentional. Instead of just reacting to a stuck point, your supervisor is trained to think, what's the supervisee struggling with right now? What role would be most helpful, and what focus area are we actually working on here? That process makes supervision more strategic, targeted, and useful to you, not just in the moment, but over time. It also helps you learn to identify what kind of support you need. For example, if you're feeling overwhelmed and unsure with what to do with a case, the issue might not be your interventions. It might be your conceptualization. Maybe you need help seeing the forest instead of the trees. So if your supervisor is asking how you're conceptualizing a case and you're not sure what that means, it's okay to say that. It's actually the supervisor's job to help you learn how to think like a therapist, not just act like one. But ultimately, the discrimination model isn't just about giving feedback. It's about fostering critical thinking, emotional awareness, and ethical practice, and skill development in a way that evolves alongside you as a clinician. It's meant to grow with you. The Integrated Developmental Model, or IDM, is by Stoltenberg and Delworth in 1987, and it's also really popular because it gets right to the truth. Your supervision needs to change as you gain more skill, confidence, and self-awareness, and good supervision is meant to grow with you. So the IDM tracks your development in 3 areas: self-awareness, which is how well you know your own reactions; motivation, how secure you feel about your work; and autonomy, how independently you practice. Depending on where you are, your supervisor adjusts how they teach, challenge, and support you. And this part is hierarchical. It moves throughout levels. So in level 1, that might be when you're brand new or feeling a little shaky. You want clarity, structure, and steady reassurance. Your supervisor here will generally be more directive, teaching you the basics and watching you closely. So think about learning how to drive. At first, you grip the wheel tight, you check the mirrors every 2 seconds, and you sweat over every turn signal. You need somebody telling you exactly what to do and when. Or think about a baseball pitcher. At a level 1, you master one good pitch. You throw it the same way every time until it feels solid. Now, a level 2 clinician has skills and confidence and is also newly aware of gaps that maybe they didn't see before. You might avoid hard topics or push back because it's uncomfortable. So your supervisor here is going to help you stay steady through that discomfort, sharpen how you make sense of cases, and push you to reflect deeper. When we're thinking of like driving, it's like merging onto the highway alone, but sometimes you drift or second guess. Or in baseball, you've learned several pitches, a fastball, a curveball, a slider, but you're not sure which one might work best for each batter. In level 3, you're skilled, autonomous, and comfortable with your clinical skin. You welcome feedback and handle complex cases flexibly. Here, supervision shifts into partnership, more like peer consultation with targeted feedback. With our driving metaphor, it would be like you're cruising with confidence. But the catch is that it's really easy to go on autopilot and zone out between points A and B. Supervision at this level brings you back to intention, noticing the road instead of just driving by habit. Or for our baseball metaphor, you're not only knowing all the pitches, but you also know when to throw each one to get a strikeout. And that's where the IDM started, level 1, 2, and 3. Later in years, they redid it a little bit and they added this level 3I. And this is an insecure integrated. So if you're mostly level 3, but sometimes second guess yourself or feel a bit shaky, supervision for a level 3I can help clear up the remaining fog and reinforces a solid professional identity. And the IDM reminds us that even the best, most seasoned counselors need supervision that keeps them reflective and intentional so that they don't just do the work well, but they think deeply about how and why they do it. It's not about coasting on autopilot, about driving mindfully every time you get behind the wheel. And the next one that I want to talk about is the Systemic Cognitive Developmental Supervision Model, or the SCDS. And it's built on two big ideas. The first is that it's systemic, which means that we don't look at you in isolation. We look at the systems shaping you and your work. We're also going to look at the client's systems, their family, their culture, their community, the agency system in which you work, our policies, our team dynamics, broader cultural systems like social norms, oppression, and privilege, and the relationship system between you and your supervisor. We know these systems affect how you practice, where you get stuck, and how you grow. Supervision helps you see these connections clearly so that you don't get tunnel vision. And the second idea here is that it's cognitive and developmental. It's in the name. And this just means that supervision helps you grow in what you know and how you think. This model uses 4 cognitive orientations, or ways that your brain makes sense of information. The first being sensory motor. That's going to be when you focus on what's right in front of you, actions, behavior, step-by-step details. And what you glean from all of this is in a sense of emotion. You might feel your work with clients deeply within you, or you might be really focused on how they're feeling. A concrete orientation is when you look for simple cause and effect explanation. So an example here would be, well, he's missing sessions because his ride keeps canceling. There's an excuse, and it's very clear and logical. A formal orientation is going to look for analyzing patterns, thinking abstractly, and connecting details into bigger themes. So an example here might be this pattern of missing appointments might be connected to his ambivalence about recovery and fear of failing again, not just that his ride keeps canceling. And then the fourth orientation is called dialectical or systemic. And you consider multiple perspectives, contradictions, and contexts. And that might be client, their family, their cultural factors, and how they all interact. So an example here might be that your client's behavior makes sense when we look at the family pressure, cultural stigma, and how his previous treatment experiences shape trust issues. So the goal in this model is twofold. We want to look at horizontal development, which means that you focus on your cognitive orientation of choice or preference, or where you sort of naturally shift. So if you naturally fall within a sensory motor orientation, we want to make sure that you're able to shift fluidly, growing in deeper capacity for more complex thinking within that sensory motor orientation. You don't just learn more facts, you're going to develop wisdom about how to navigate multiple truths, contradictions, and context, all when focusing on sensory motor. And then there's also that vertical development, which means that you're going to become more flexible and able to shift in fluidity between multiple thinking orientations as needed, so that you don't always get stuck seeing cases only in concrete terms or only in sensory motor terms, but more so at the bigger picture where you can shift between all 4 equally and gracefully. And if there's any art therapists that are listening to this, if this model sounds familiar, it's because the systemic cognitive developmental supervision model overlaps really beautifully with the expressive therapies continuum. Both frameworks are grounded in Piaget's cognitive developmental theories and emphasize how humans shift from sensory motor and concrete processing to abstract and symbolic meaning making. In art therapy, you know that how we choose or modify art materials to match or gently stretch a client's level, for example, moving from tactile clay work, which would be more sensory motor, towards symbolic or metaphorical meaning making, which would be cognitive and symbolic. Systemic cognitive developmental supervision does a similar thing for your thinking about clients. It helps you notice whether you're processing cases in a step-by-step concrete way or seeing the whole relational system, and then supports you in moving up and down that continuum as needed. So because art therapists are already trained to track sensory, perceptual, cognitive, and symbolic processes, this supervision model is especially good fit for them. It helps them use their natural flexibility with materials and imagery to expand the same flexibility in how you conceptualize, intervene, and reflect on your work. So whether you're sculpting with clients or talking it through a stuck case in supervision, you're practicing that same skill, staying aware of how you're processing and choosing to shift gears when it helps the work. So this model in practice might look like your supervisor listening for how you're making sense of a client. If you're stuck in a concrete loop, they might guide you to see broader patterns. If you're lost in abstract ideas, they might pull you back to here and now actions. So, a tip here is that if you ever feel stuck or keep replaying the case in the same way in your mind, supervision using the SCDS might ask, what would happen if we looked at this through another lens? And then help you practice that lens together. And at JADE, we know that good trauma-informed care starts with good trauma-informed supervision. We borrow these ideas from the Sanctuary Model, which is a well-established approach using counseling settings to build safe, healing, and focused communities for people affected by trauma. In counseling, the Sanctuary Model helps staff and clients work with a shared language of recovery, accountability, and safety. In supervision, it reminds us that our teams and our relationships are systems too. And if we want trauma-informed care for our clients, we need to embody it with each other first. A key piece of Sanctuary is the S.E.L.F framework, S.E.L.F, which stands for Safety, Emotions, Loss, and Future. And this simple structure can shape how supervisors and supervisees talk about challenges and growth areas. It keeps conversations organized, clear, and deeply respectful of trauma dynamics. So here's what S.E.L.F brings into supervision. Starting with safety, it's not just physical safety, but psychological and moral safety. Knowing your supervisor won't shame or surprise you, and you won't be punished for being honest. In emotions, it's going to be the permission to name feelings rather than act them out or bottle them up, including feelings about clients and feelings about the supervision relationship. When we're looking at loss, we're recognizing that growth often involves loss, maybe giving up old ways of working, unrealistic expectations, or past habits that feel familiar but don't serve you now. And in future, we're keeping an eye on where you want to go, your goals as a counselor, your career trajectory, and what you need from supervision to get there. So why do we use S.E.L.F in supervision? Because trauma distorts safety, emotion, loss, and future. And this framework gives both supervisor and supervisee an easy shared map to check in with each of these 4 areas so nobody gets stuck in just rehashing what's hard. It keeps supervision solution-focused and hopeful. So if your supervisor is asking, what's feeling safe for you right now? What emotions are you holding? What losses are you carrying with you as you grow? And what future are we working towards? That's just Sanctuary in action. So together, models like Sanctuary and S.E.L.F help supervision at JADE feel safer, clearer, and more human. So now that we've covered the foundational models of supervision, let's shift into some of the real-life dynamics that show up in supervision, especially in a field like ours where the work is emotionally heavy and the lines between personal and professional can get blurry. So just diving in, we're going to talk about countertransference, and that's when something personal in you gets activated by your work with a client. It can happen in the middle of a session or even later in supervision when you're still thinking about that one client who left you feeling frustrated, sad, or confused. And it's not something to avoid. It's actually just data to be aware of. Because you're human working with humans, you're going to experience countertransference. They're going to bring something out within you. And there's definitely ways to use countertransference to help inform how you work or where you go next with a client. But some common signs to be aware of here are if you're feeling dread in sessions with a certain client, or if you're feeling unusually protective, judgmental, or emotionally reactive about some of your clients, or maybe you're noticing a pattern of rescuing or over-disclosing, or maybe even avoiding certain topics with clients. And it's not a sign that you're bad at this. It's just a sign that you're a person. What supervision offers is a safe space to name it, to look at it, and to understand where it's coming from. So if you're finding that you might want to say something like, I'm having a hard time not taking this thing personally, or maybe I don't know why I keep softening the boundaries with this client, I just feel bad for them. When you name it, you take its power away. When you hide it, it tends to run the show. So don't be alarmed if your supervisor might sense some of this countertransference coming up and sort of try to poke at it a little bit. It might be a little uncomfortable, especially if you're trying to avoid it, but it's actually going to help you do better work with your clients if you're able to recognize it and how it's impacting you. And in substance use disorder treatment, I also want to talk about compassion fatigue and burnout. We carry a lot with us. People relapse, people ghost us, people come in deeply wounded and are unsure if they want help at all. And it all takes a toll. Some signs of compassion fatigue or burnout can include emotional exhaustion, cynicism or numbness towards clients, feeling ineffective no matter what you do, isolation or detachment from the team, and questioning your competence or purpose. So supervision itself is actually one of the best protective factors against burnout. It's a place to process emotions, slow down, and remember why you care about this work in the first place. So if you notice yourself checking out, or maybe skipping supervision sessions and not rescheduling, or maybe even breaking down, don't wait to address that. Make sure that you're attending supervision regularly and that you're talking about all of this in supervision. I also want to talk a little bit about productive versus non-productive supervision relationships. So not every supervision relationship will click perfectly. Sometimes there's a mismatch in style, communication, or expectations. Sometimes a rupture happens. Maybe you get critical feedback that didn't land well, or you feel like your questions aren't being taken seriously. So there's some red flags for non-productive supervision. And that's going to be avoidance of difficult topics, or maybe an over-focus on paperwork without discussion of clinical work, or maybe a lack of feedback or feedback that feels vague or shaming. Or maybe a red flag would be if you leave supervision feeling more confused or alone than when you came in. So the good news is that all of this is repairable. So in your supervision sessions, if you're catching any of this, you can try naming what you need. Say something like, I think I need more specific feedback on my clinical work. Or you can even ask for structure. Can we spend part of our supervision on case conceptualization? You can also re-engage around shared goals. I want to grow in this role, but I need some direction of where to focus. So feedback is a two-way street. Your supervisor may give it, but you can give it too, kindly, respectfully, and with the shared goal of making supervision more useful. And remember that your supervisor is not a mind reader, just like you as a therapist cannot read your clients' minds. If you have a need, you need to share it. And another thing I want to touch base on is administrative versus clinical supervision, because at JADE, we talk a lot about supervision as a growth space, but there's another side that matters just as much, which is administrative supervision. So let's break these terms down. Administrative supervision focuses on documentation compliance, productivity, policies and procedures, and ethical and legal obligation. Clinical supervision focuses on conceptualizing cases, counselor self-awareness, intervention skills, boundaries, ethics, and emotional development. And they are not competing forces. They are often integrated, and we need both. In substance use treatment, clients often have complex lives and high-risk needs. That means that we must document clearly, and we must meet productivity expectations to serve as many clients as possible. But we also must understand how trauma, addiction, and identity show up in the room, because clients don't just need a compliant therapist, they need a competent one. JADE expects supervisors to hold you accountable to both, supporting your growth and ensuring that we're meeting external standards. So whether we're talking about countertransference, burnout, feedback, or structure, supervision is where it gets worked out. And when it's done well, it doesn't just make you a better clinician, it makes this work more sustainable, more human, and maybe even more fulfilling. So far, we've talked about supervision as a theory, a relationship, and a practice. Now let's ground it in real life. So what does it look like when you're actually sitting with your supervisor or reflecting on how you're doing this work? At JADE, we use a handful of tools and frameworks to help keep supervision clear, supportive, and human. But here's the thing, none of these tools work by magic. And your supervisors aren't mind readers. We have every tool, resource, and framework in the world, but if you're not telling us what you need, what you're struggling with, or what you want to work towards, we can't show up for you in the ways that matter most. These tools are here to help you put that language to all of that. They open the door for honest conversation about where you are, what's feeling good, what's feeling hard, and what kind of support will help you grow here at JADE and beyond. So one of these tools is a supervision development plan, and you're going to think of it like a living map. It helps you and your supervisor get on the same page about your goals, your learning style, and your current edges. If you're new, it helps you clarify where you want to build. If you're experienced, it helps supervision stay fresh and relevant. And if you ever supervise others one day, it will remind you of how to do it with care and clarity. It's not busy work, it's a conversation starter. Here's how I learn, here's where I feel strong, here's where I feel lost, here's what I need more of. Think of it like a treatment plan with a client. They're important, and when they're done well, they can really help facilitate change. And supervision doesn't just care about your performance, it's also about your well-being. Sometimes we use short tools like the Pro-QOL or the Flourishing Scale to check on how you're really doing. These are optional, but they give you language for quieter struggles, burnout, compassion fatigue, meaning making, because burnout doesn't usually yell. It usually creeps in quietly until somebody asks, hey, are you okay? Another tool that we use for growth are chart reviews. Yes, we look at your charts, not to catch you, but to make sure that your documentation backs up your good clinical thinking. And the template that we use looks at making sure that your treatment plans are current and updated, that your notes are matching the content of your sessions that you're reporting in supervision, and that your chart is telling the whole story about your client. And this keeps your paperwork strong, and it protects you, your clients, and the agency. And at some point, you can expect your supervisor to ask hard but caring questions. Is this work or is this setting still a good fit for you? It's not an insult, it's supervision doing its job. Your supervisors aren't just shaping you into a solid JADE therapist, but they care about the bigger picture, your career, your well being, and your life outside these walls. Whether you're here for years or you find your next adventure elsewhere quickly, the goal is to grow you into the best version of your professional self. But we can't do it alone. We need you to show up honestly, to use the tools, to tell us what's working and what's not. And that's how good supervision works. We don't read minds, we listen to yours. So just remember, growth doesn't happen by accident. It happens when you pause, reflect, and ask for what you need and allow yourself to be supported. These tools are not just paperwork, they're invitations to show up fully for your own development with clarity and self-compassion. Next up, we're going to talk about what meaningful, authentic supervision feels like and how to advocate for the kind of supervision that helps you thrive. So let's wrap this up by coming back to what supervision is really about, not just in theory or paperwork, but in spirit. Supervision at JADE is grounded in relationship, and the relationship is the method. Because at the end of the day, no checklist or model means much if you don't feel seen and cared for as a whole person. We know this work is hard. It asks you to sit with pain, uncertainty, and people who sometimes don't want help but desperately need hope. So supervision has to be more than just a place to talk about billing codes or your clients. It has to be a place where you bring your worries, your doubts, and your very human questions. So here's what makes it work: when we both show up authentically. So ask those questions even if you're afraid that you're going to sound dumb, because they're usually the really good questions. And say out loud when you feel lost or stretched thin. Bring that part of you that doesn't have it all together, because that's the part that supervision can actually support. If you leave supervision feeling a little uncomfortable, a little stretched, or a little more aware of your blind spots, that's good. That's growth. And growth never feels tidy. Being vulnerable in supervision doesn't mean you're failing. It means that you trust enough to learn out loud. So much of becoming a strong clinician happens in that middle place between confidence and uncertainty. It's not performance. You're not here to impress your supervisor. You're here to learn, reflect, and let somebody help you become the best version of the counselor that you want to be. And remember that you're learning how to be a clinician, not just how to do therapy. Techniques and diagnoses matter, but they're not the whole story. Good supervision helps you explore how you show up, how you listen, how you hold boundaries, how your history, values, and identity shape the space that you create for your clients. That kind of growth takes time, it takes patience, and it takes trust in the relationship that you build with your supervisor. So as we close, I want you to remember that you're not expected to know everything, but you are expected to stay curious, open, and connected. Vulnerability is a strength and not something to hide. You never have to wait until you're drowning to ask for help. And your supervisor is not here to perfect you. They're here to help care for you while you grow. So let's end with this. Good supervision doesn't just make you better at counseling, it helps you stay in this work, whole, supported, and human.